Hi, I'm Dr. Michael Atola, and I'd like to welcome you to the 2014 Patterson-Sirona Technology Summit. I'm sitting here on the panel with our esteemed guest, Dr. Joe Blaes, the editor of Dental Economics Magazine. Nice to have you here, Joe.
It's good to be here,
To your
Mike.
left is Dr. Sam Puri, who's the director of CAD/CAM at Spear Education and the founder of CERECDoctors.com. To his left, Dr. James Klim, who is the founder and director of CADStar, has a private practice in Santa Rosa, California. To his left, Dr. Tarun T-Bone Agarwal, who's really kind of shown a lot of us the way in terms of integrating cone beam and CEREC and how they can work together. And to his left, Mr. Roddy McLeod from Sirona Dental, the VP of CAD/CAM, and somebody who's been instrumental in trying to bring this technology to more dentists and have more indications within the system so more patients can take advantage of this wonderful technology. Joe, you went to dental school a few years before I did, and it must blow your mind, you know, as starting with a belt-driven handpiece, you know, and then working your way forward to an air rotor to kind of see what's available today with this type of technology. What are your thoughts when you see something like this?
You know, it's really amazing what I've seen over the last few years and the advancements we've made. I mean, to hear Dr. Brown say that he did an implant and a crown in an hour and a half,
right,
finished, start to finish. I mean, that's just amazing stuff. You're right. It really has changed. You know, from a practice standpoint, I'm really convinced in today's world that the digital dentistry can just be a real game changer for the dentist. It makes him more efficient,
right,
more effective.
Right.
In the end, he becomes a better dentist, but the person that really gains is the patient,
right?
Because the patient gets better.
And a dentist who's living proof of that is Tarun. You know, he
Exactly.
shared some numbers the other day when we were sitting at a lecture together, and his practice, the way it's increased. Briefly share what your practice has done, say over the last 7 or 8 years when you integrated CEREC into your practice.
Yeah, it's interesting. We've had 3 what I call disruption points in our practice, and the first one was in 2005 when we first implemented CEREC dentistry, and we saw a nice increase and bump in our practice. The second one occurred in 2009 when we added cone beam dentistry to our practice, and then from there when we added the OmniCam in 2012. And what we've seen in the last 3 years is a tremendous, not a linear growth, but a definite upswing in our practice. And that's driven from a few things. One, it's dentistry being more efficient using digital technologies, and more importantly, it's the services and the scope of services we can provide for our patients. And those are the 2 things that have fueled our practice.
Yeah, we know patients don't want to necessarily go out and have a specialist place an implant and come back and bounce back and forth between 2 offices if they can have it all done in one office.
That's always been the greatest problem we've had in our practice is the fact that we have to send our patient out to a strange office.
Right.
I mean, they're used to us. They're used to coming to. They're used to our people. So that's always been a problem.
And how nice is it to be able to have somebody, a patient who wants to be treated by you, where now it's not just a crown, but it's an implant or 2 and some maybe a couple of abutments and a couple of crowns. And now all of a sudden you're doing more treatment on this one patient. Every dentist would rather do 10 crowns on one patient than one crown on 10. And so it's allowing really GPs to become more like specialists because they're increasing their indications, and you can see it when you see the kind of growth that Tarun had in his practice.
Right.
So do you have any questions for any of our panel members?
I do, and anybody could pick up on this. How is the 4.3 software going to help me clinically and both myself and my team from a clinical standpoint?
I'll take that, Joe.
Right.
It's the 4.3 software is just a huge improvement of what we've had. Now, every time a new software comes out, we say that it's better than before. But this is really a nice game changer in the sense that, one, it makes imaging much easier. When you pick up that OmniCam, going from the red cam to the blue cam to the OmniCam, it's always been a big change. But now with the OmniCam, I can put it in the mouth. I just kind of wave it around. There's nothing else needed from me, just a little bit of retraction. And you pick up exactly what you want to pick up. That makes it easy. The system gives you hints. It tells you, hey, you've taken a good impression or you haven't taken a good impression, which means that you can train your team to kind of pick up on that. They can now be much bigger part of the imaging process if the states allow it. They can be a part of getting feedback to the clinician. But overall, it makes the entire process just more easier for the dentist. to just pick up, scan, design, and mill.
Great.
With
Yep.
that, reliability is huge. I know that in the past, I always would wonder, is my impression distorted? Does it have all the markers I need on it? I can delegate this to my team, and they can take as good predictable impressions as I can, and it's
Wow.
as long as I don't get their tongue or my finger in the way, it's distortion free.
Right. That's great.
And it's interesting in California because if you're an RDA, just a registered dental, not just, but a registered dental assistant, you can take a digital impression in California, but to take a polyvinyl impression, you have to be an RDA EF.
Right.
So there seems to be this knowledge on the part of the board that it's a more dangerous and more difficult kind of impression to take because you don't have to be as qualified, as high up to have that degree.
That's interesting.
I think
Yeah,
it
that's an
goes to the
interesting
fact
point.
that if your assistant takes a PVS impression and you don't get it properly, you're now spending another 4, 5, 6, 7 minutes to redo that impression. If I screw up on the CEREC impression, I just go back with the camera or my team and just pick up the defective areas.
Just
and
the part you've missed.
Just the part that you've
Okay,
missed, and the
all right.
software tells you what you've missed.
Okay.
So I think that's
And
huge.
it's in retina display symbolically now. I mean, I can see a fine line knife edge margin, even subgingival, and if you can see it, you've got it.
You've got it.
Yeah.
Okay.
These are things you can't do with reversible hydrocolloid, polyvinyl siloxane, polyether.
Yeah, use that.
Or
that
rubber
point,
base.
to that point, I mean, this is the promise of technology, isn't it? This
Right.
is what we really always hope for, is that we can use technology to make our work better. And this is one of those examples. And with 4.3 specifically, as Sam said, we took steps to ensure that we took some of the potential for error out and built in a little bit more automation so that jumping into CAD/CAM, jumping into chairside dentistry is a safer, more predictable process than maybe what people might have thought of in the past.
Now, is this something that I have to have an OmniCam for, or can I do this with a Blue Cam? Or
Yeah,
what's-
it's an update for both camera systems, exactly, because we still offer the Blue Cam and the OmniCam both at the same time in the market.
Okay. All right.
Which is important because, now you've got different price points, 3 different price points
Right.
specifically where dentists can get involved. And if they feel like they don't necessarily want to go for, the top of the line product, there's a more affordable way for them to get involved with the same type of dentistry and still be able to deliver this kind of quality and convenience to their patients.
Right.
Which is nice. What do you think about the idea of being able to use it for ortho, for example?
Well, that was my next question. You took it right out of my mouth. My first question was, you introduced it, or it was introduced at the AAO meeting. Does that mean it's only for orthodontists, or is it for GPs too?
You know, what we did at the AAO meeting, when was that, in April, May? Anyway,
somewhere.
April or May, somewhere in that range. So many trade shows, Joe. That's
Right.
the problem. But in I think it was May. In May, we showed it at the AAO because, of course, that's the largest concentration of orthodontists and those who are participating in the orthodontic market,
Right.
including GPs who are doing orthodontics. And we showed what was a work in progress at that time. And our goal is by the end of the calendar year to make that commercially available. But it's available to GPs as well as to orthodontists.
Well, it certainly makes sense because I can remember how many kids threw up when I was taking impressions for orthodontics.
This was one of
in my practice.
it was amazing because we asked orthodontists throughout the process of developing, why would you want to use a digital impression in camera? Because we have to understand what people think. And they said, number one is model storage. We want to get away from
Absolutely.
physical models. Number
Right.
two was, I want to offer digital and not physical impressions. And number three was more about connecting to other services or providing other digital treatments or creating a unique feature of that practice, of that orthodontic practice versus the other orthodontic practices in the area. So people are using the technology to, let's say, create a unique experience within the practice.
Is the dentist going to need more training to use the 4.3, or is it pretty intuitive, or?
I think it's fairly
Very
intuitive.
intuitive.
Yeah, I mean, obviously there's new features anytime there's a new software updates out, and you can learn about those new features. But the bottom line is, it's just if you're comfortable with the previous version of the software, you can find out, hey, here are the new features, and just apply it. I mean, training is always helpful, but it's certainly not mandatory with the new update by any means.
Okay. Great.
back to the, I've had a chance to work with the CEREC ortho scanning software,
Okay.
and it's self-guided.
Oh.
And so I can obtain upper and lower arches and the bite in about 5 minutes.
Really?
My team can do that. I can come in and just check, and if it looks pretty, it's going to be accurate.
That's fantastic.
pretty nice.
Yeah, that
Yeah.
is really nice.
It's
That
really
is
nice too because now CEREC really has a very conservative option for improving a patient's smile. I think, we all have done our fair share of veneer cases, but when we do a veneer case, we're removing tooth structure. The patient's now married to these veneers. If they live to be 100, they'll probably need to be redone 3 times. Moving teeth around and bleaching them, when appropriate, is a great way to be able to improve someone's smile. And it's nice that dentists can now do it through the same CEREC portal that they use for making these other restorations, like veneers.
Mike, I think it rounds out the offerings of the system. I mean, before it was inlays and onlays, then it was crowns. Now we have implants, and obviously now the next frontier is orthodontics. So it's a complete system. You're not, when you're looking at purchasing a CEREC and you're looking at, is this going to fit into my practice? Previously it was, hey, I'm doing a certain number of crowns with my laboratory a month, and is the cost of the CEREC going to replace that laboratory cost? That's what it was 4, 5, 6, 10 years ago. Today, with all of the different indications, the cost, in my opinion, is just irrelevant because there's so many things that you can do with it. Ortho, implants, all of your restorative work. So it's a huge advantage, in my opinion, to go digital with all this stuff instead of being analog.
I agree. Absolutely. Anything else, Joe, that you've got to...
What about for implants from the implant side? What does 4.3 do for the implant side?
I think we're entering a new frontier for implantology. And Joe, we've talked briefly about it together before, but I think the day is coming where the process of implantology, taking multiple visits, multiple doctors, multiple locations, multiple disciplines, is coming to an end. As general dentists or specialists utilizing this technology, we're going to get implants in the most conservative manner placed to the patient in the most ideal position and restored with a customized restoration. And we're going to see the day where we're doing this in 1 to 2 visits without any level of compromise. And the beauty of this is the system is safe. It's reliable, it's predictable, it's team-friendly, and it's very applicable to everyday dentistry, and it is economically very feasible. In fact, I would say that it's economically better using the technology than not using the technology.
I mean, what if this technology became so easy to use, Joe, where CEREC allowed you, through its simplicity, what if the extraction became redefined? So no longer was an extraction just the removal of a tooth. The modern extraction, 2016 and beyond, involved the removal of the root and the replacement of it with a titanium root. If you're going to remove a tooth and put an implant in every time you do it, now you're giving the patient the option to have a crown later, even if they have 2 kids in college right now.
Exactly.
And they can't afford it, but they can in 3 years because maybe they'll have insurance then. And so getting away from this idea of prepping 2 teeth for a bridge, virgin teeth, which is just awful, and giving somebody the opportunity to be able to do it later, even if it was done for free or very low fee. And if it just became the mindset of, why would we take a root out and not put the new one in so you could have a new tooth later? And as this gets easier and continues to get easier to do, I see a future where every time we take out a root, we'll replace it with another one.
Joe, one of the things that we're seeing with regards to implants, in our courses, one of the things we're seeing is periodontists come through the program. Specifically, they're purchasing the CEREC so that they can go ahead and fabricate implant abutments for their referrals. So the referral sends in a doctor, they place the implant, they use the CEREC system to fabricate the actual custom abutment. And they say, here you go, doc, thanks for the referral, this is my gift to you. I know several periodontists that are doing that, and they've grown their practice significantly, working with the doctors, utilizing the CEREC technology. So when you talk about implants, and what T-Bone said is absolutely correct, it's a whole new world that we've opened up with the ability to do, same day or same visit implant dentistry at a much lower cost. I mean, you don't have the cost of the custom abutments. The entire cost is significantly lower when you do it with the CEREC system.
One last comment from me. I'm sorry, James. I apologize.
I'd love to listen to you.
I think one of the things that we've missed in this point is CEREC covers every major implant system. This is not locked in to, I have to use XYZ implant.
Yes.
And that's one of the things I love. So when I get patients back from my specialist and they have X implant or Y implant and I use Z implant. It's the same process, same system, same technology, same process. It works fantastic. So I just wanted to make that point. I apologize, James.
It's incredible. When you think about the one-piece implant restoration, we're not leaving cement underneath the soft tissue. That's big.
That is
and
huge.
I've spoken to the oral surgeon groups in our town, and they drool. They're saying their number one problem is trying to mend between the patient and the doctor, not wanting to lose their referral source, and also having to take care of the problem of cement.
Right.
I think with EMAX and the system that we have to restore, it's so intuitive in the software and the products that we have, it becomes streamlined and very predictable.
Well, from what I've seen is how excited you dentists who are using the system, particularly for implants, get. I mean, it just a smile lights up on your face, and as you talk about this.
Well, you have
what
control.
You do.
You have
Yes.
control over the process. Previously, we had control over the restorative process, crowns, inlays, onlays. Now we've got control of the implant process. I mean, we're not just talking about the restorative solution here, because the CEREC system combined with the Galileos and the XG 3D, you have control over the placement of the implant. So it's a complete solution. And as a clinician, we like control, and we like to make sure that things happen the way we want them to happen.
All right.
And the CEREC system gives you that.
And it's great for the patients.
And that's the bottom line. Anything that we do, we should absolutely look out for the patient. Are we in the best interest of the patient? And if I can be more conservative, if I can lower the cost of treatment, if I can give them more options, that's always a good thing. And obviously doing it all in, as few visits as possible, which is what the system allows you to do.
That's great.
And not to leave the Patterson part of it out of the equation as well, because I'm sure you'd agree that when a dentist makes this kind of significant investment in technology like this, they don't want to be left alone or left behind or left on an island.
Right, yeah. They need that support all the way along. Absolutely.
And so
I think Patterson is in there doing that.
Yeah, and as you look around here, you'll see, the 500, Patterson employees spending a week here, just in class from 8 till 5. I mean, it's beyond what we went through in dental school, minus the cadavers. I don't think there's any, but it's amazing to see that type of dedication, and they are committed to the success of their dental clients. It's absolutely born and bred between these two organizations. It's quite a partnership.
Mike, maybe if I can add a little bit to that point, because in the global position that I have now, I'm able to witness what's happening in every market around the world. And what I see is actually in the United States, there's the highest customer satisfaction levels that we have, and it's directly related to Patterson's commitment to follow up with every customer who purchases a CEREC system, get them into the appropriate training courses, and then follow them through their first 30, 60, 90 days, make sure that they have everything that they need, the resources, the training, the support, and what we see actually is that the level of utilization of the CEREC system is the highest in the United States than it is anywhere else. And this is a tribute to the fact that Patterson's really picking up that ball and saying, doctor, we're going to hold your hand through this process. We're going to walk you through this, and you're going to be successful. And that commitment is the reason why Sirona and Patterson are in the exclusive relationship that they are with our products, because as good as the technology is, the dentist needs to feel that they can safely enter that field and have success, and you need a partner with you to do that. And for us, that's Patterson.
Anything else, Joe? Any final questions that you have?
I think we've covered it all.
For the panel?
It's really great.
Well, thank you so much. Thank you, from us, from the dentist, for all you do for GPs with dental economics, and thank you for taking the message of the Technology Summit and sharing it with your readers and viewers online. We really appreciate that.
Happy to do that.
On behalf of myself, Joe Blaes, and the rest of the panel, I want to thank you for your time and your continued commitment to quality dentistry.